Hello, radiologists. Our brain is a muscle. If we don't use it, we'll lose it. So let's go to the radiology gym and start practicing. I'm Dr. Ahmed Abdulwahab and I'll be your coach for today. Stay with me. Okay, so today we have a new radiologist. She wants to see if she has the muscles for practicing radiology and want to train with us. Of course, you are welcome.
Oh, thank you, sir. I wish you go easy on me.
Well, don't worry, we'll try our best. Okay, so this is a brain MRI of a 50-year-old male patient presented with long-standing scalp swelling. So brain MRI was requested.
Okay, sir. So this is coronal flare images of the brain of a 58-year-old male patient showing I can see some vasogenic edema here and there, and now I can see some ill-defined lesion, probably centered on the meninges. Can I have axial T2 weighted images?
Sure.
Okay, so these are T2 weighted axial images of the brain, and near the top of the skull, we can see a lesion that's relatively not very well defined, and it's causing mass effect on the adjacent brain parenchyma, especially the posterior aspect of parietal lobes, and it's causing some vasogenic edema. Do we have sagittal images?
Yeah, sure.
So this is a sagittal T2 weighted images. And here I can see that there is a lesion that is extra-axial located at the posterior aspect of the midline at the level of the parietal bones, and this lesion is involving the inner and outer tables of the parietal bones and is extending into the subcutaneous tissues of the scalp. This lesion is causing, it's an extra-axial lesion causing mass effect on the brain parenchyma, both right and left parietal lobes, with a vasogenic edema.
Good job. Very good job. So what you want to do next?
Well, I want to give contrast, IV contrast.
And these are your post-contrast images.
So this is T1 post-contrast axial images showing that the previously described extra-axial lesion is showing diffuse heterogeneous post-contrast enhancement, and it's centered along the posterior aspect of the falx cerebri, both right and left. So it's encasing the posterior part of the superior sagittal sinus, and obviously it's extending through the skull into the subcutaneous aspect, both and to the intracranial cavity and to the outside. And on the sagittal images, we can see almost the same findings. You can see the lesion here and extending both intracranially and extracranially, and it's causing mass effect on the deep brain parenchyma.
Okay, so can you summarize your findings, please?
Okay, this is a brain MRI of a 58-year-old male patient with scalp swelling showing an extra-axial lesion located in the posterior aspect of the intracranial component surrounding the falx cerebri and extending through the outer and inner tables of the skull into the subcutaneous tissues. It's causing mass effect on the adjacent brain parenchyma with vasogenic edema here and there. And after a contrast injection, we can see that the lesion is showing diffuse heterogeneous post-contrast enhancement, and it's the involved part of the bone is also showing post-contrast enhancement.
So what's your diagnosis or differential diagnosis?
Well, since it's based on the Fox survey on the dura, so the main differential diagnosis will be a meningioma, and since it's extending through the bone, I would suggest hyperostosis and extension into the extracranial component. My second differential diagnosis will be some sort of aggressive meningioma. For example, hemangiopericytoma, which in this case, I think it can be hemangiopericytoma because of the aggressive effect. Also, meningeal sarcoma is possible, and metastasis is a possibility. However, usually it does not present like that.
Wow, you're a really good radiologist. Thank you very much. Very good description, very good approach. I would love to have you again and keep practicing with you.
Well, thank you, sir. I'm so happy to hear that.
See you later then.
Okay, bye-bye.
Bye-bye. So this was our exercise for today. Don't forget, keep practicing and we will be better at our job. Don't forget to like, subscribe, share, and tell your friends about us. If you are looking for private training sessions, send a message to the email in the description box and we will arrange something. See you later. Bye.